Hello. Today we're going to talk about menopause labs. Do you actually need them? How is menopause diagnosed? I get those questions a lot. Like, can I check my hormones? So let's talk about if that's one never even necessary. And if you do want them, what should you be getting and what do those labs actually mean? So, first of all, remember menopause is when you've actually hit 12 months of no period. The perimenopausal phase is when you're having this wackadoodle symptoms and estradiol going up and down and progesterone going up and down. That is that menopausal component. Now, there are a few things that we can see that actually has some predictive value that you may not be thinking about, that you might actually hit menopause in the next 6 years. So we'll get to that here in a minute. So first of all, welcome to this channel. If you are new to me, I'm Dr. Lori Marvis. I'm a board certified family and lifestyle medicine physician. I've been treating patients for well over 2 decades, have seen patients across this country as I am licensed in all 50 states, including DC. So it's really fun to be a part of people's health journey. I myself, I will be 54 later this year. I'm in this perimenopausal phase. I share my stories and the research that I'm learning as I also want to share what I'm doing so you understand that I totally understand what you're going through. So let's talk about labs. So remember, like I mentioned before, menopause is defined as the permanent cessation of menstruation for 12-month period. Now, let's say you go 11 months and you have a period, you are still in perimenopause. But if you've hit this 12-month mark and you're, around beyond the age of 45 to 55, you've probably hit in menopause. Now, some women, especially younger women, younger than 45, should consider having additional testing done and determine if hormone replacement therapy is appropriate for you because it can decrease your risk of more progressive osteoporosis, heart disease, and such, brain health. So that's really important, especially if you're under the age of 45. Okay, so what is the clinical evidence? So most of the time you don't need labs, right? So if you've hit this 12 months, you don't need labs. That's a clinical diagnosis. However, for those who do want to, there's a few different ones you can do. First of all, number one is the follicle stimulating hormone, or FSH, right? So this is a little hormone that's released by your pituitary gland. And when you have this, remember, FSH kind of is like think of it as the initiator, right? So it's responding to the ovaries. If you have low levels of estrogen, progesterone, FSH goes up, right? It's telling, hey, ovaries, I need you to make some more of this hormone. Well, if your levels are high, that would indicate menopause, right? So if you're thinking about levels above 40, it's probably indicating menopause. However, FSH might be inappropriate for women age 45 or over, just because, again, like I mentioned, you are probably in menopause if you've gone those 12 months. Just sharing that. There's another one called luteinizing hormone and, of course, estradiol. Now, when these hormones are sometimes measured, adding LH and estradiol to your FSH doesn't really improve your diagnostic accuracy. So you could really just get away with doing your FSH, because even in perimenopause, your estradiol is going to be up and down. And so it doesn't really give you a full look at everything. The FSH really is the one key hormone that you want to be paying attention to, because like I said, it's going up because it's listening to the levels of the estradiol that your ovaries are producing. Next to that is the anti-Mullerian hormone, or AMH. That's actually a good predictor of the onset of menopause. An AMH level less than 0.39 indicates a high probability of menopause within the next 6 years. So you can have that checked as well. All of these are vaginal or serum. The next one is vaginal, which is interesting. An increase in your vaginal pH is another diagnostic tool. Of course, that's a little bit more invasive. So vaginal pH greater than 4.5 has shown high sensitivity and specificity for diagnosing menopause. So just real quick reminder again, you have your FSH above 40, luteinizing hormone estradiol, not necessarily improving the accuracy of diagnosis. You really want to check out that FSH. The AMH, which is anything below 0.39, and of course vaginal pH, which just kind of indicates you might already be there. So typically it's 12 months. If you've gone 12 months without a period, you're older than 45. Welcome menopause. If you are still not quite sure and you just want to speak to someone about that and get this blood work done, you absolutely can ask your doctor. It's a very simple blood test. You just go in and get it done, and you get some ideas of where you're at. So, hopefully, you found that helpful. I also just want to share, assessment is one part of understanding your health, but you also need the education. What is it that these labs mean? What does it mean when I should get some stuff? Am I getting too much done? Right? What are the um, general guidelines of how to diagnose something? So that's part of my framework that I love to put around different things. So, we're assessing things, we're educating you, personalizing based on one, your education now that you have, two, the assessment that you have, and then personalizing. Do you need technology? Some other things like you like to use CGMs for people who are utilizing or have difficulty with weight loss or having insulin resistance. Next, you want to be able to understand how do you actually activate on that? Like, what are the things that you need to be doing? And then how do you build a habit around it, right? So many of the things that I talk about are lifestyle interventions. Well, which ones are the best for you in your particular situation? What are the best ones for menopause? What are the best for weight loss, cholesterol, different things? So being lifestyle medicine boarded along with family medicine, it's a really fun place to be right now, is sharing that information with you and helping you make that personalized decision. Because of that, I've created a free masterclass called The 5 Steps to Master Your Metabolism and Lose Weight. But it also will help you through cholesterol and a few other things, especially if you're in this menopausal phase and have that belly fat that you've been struggling with. This might actually be very helpful. I also speak to the 4 biggest mistakes that people are making on their weight loss journey. So, again, as always, I always thank people for watching and spending time with me, because I know time is the one thing you can't get back. And I hope you found this was worthy of your time, because I do appreciate that your time is precious. So I'm sending you love, joy, peace, and gratitude, and above all, healing, because we need all those things so much more in our lives every day. So hope you have a wonderful day, and I'll be back tomorrow. And take care, everyone.